The process of fertility cryopreservation that has significantly improved with the vitrification process, which is a rapid freezing process, has been able to be confirmed or documented within the last year or so by the fact that some of the early people doing this 2 or 3 years ago are now utilizing their eggs, and the fertilization rates and the pregnancy rates of those eggs is, pretty similar to what embryos would be. And as that's sort of the gold standard when it comes to the cryopreservation process, to not have it be to anybody's detriment, is very rewarding, and it sort of confirms the fact that this technology has been effective.
And one last question, how important do you think it is to remove any stigma of surrogacy? A lot of people still don't want anyone to know they used a surrogate, and yet surrogacy seems to be growing. We know a lot of celebrities use surrogates. Some of them, like Juliana and Bill Rancic, have come out and openly talked about the fact they are using a surrogate, employing the services of a surrogate because she's had breast cancer and multiple failed IVF attempts. How valuable do you think that is in terms of just the public at large?
Well, I think it's very important to realize that surrogacy is a process that's very effective, and it allows many people, both oncology patients and others, who are unable to carry pregnancies themselves, to have children. It doesn't have to be a situation where the patient has an estrogen-dependent type of a cancer. It can be women who have had multiple uterine surgeries, fibroids, hysterectomies, whereby that's really their best option. There are lots of other medical indications for it, but it's a process that's very effective for a large number of patients, and because of not just the, I think, social implications, the financial ones prevent it from being utilized more often than it is.
That's it.